Good afternoon, everybody. Welcome to our very first budget hearing of the year in our House Appropriations Subcommittee on Health and Social Services. I am Delegate Emily Shetty, Chair of the committee, joined by our amazing crew here, our subcommittee members. We do have one new member to our committee, Delegate Stanko. Welcome, welcome. And we have some new analysts, but otherwise we have a pretty stable group here, which is pretty great. So the order of the agenda today will be the Maryland Commission on Civil Rights, followed by Maryland Institute for Emergency Medical Service Systems, and then last, the Department of Aging. On my list here, I don't have any other witnesses signed up for the first two, but we have 9 signed up for aging, so that's why we're taking it in that order. We'll start with, as we always do, so with the Maryland Commission on Civil Rights, we'll always start with our analysts. Welcome, Mr. Connor Brown, new to our analyst team. We're super excited. Welcome. I told him in our committee, we tend to throw a lot of shoes, do a lot of yelling, just to prepare him for so, nobody disappoint me here. Just kidding. We like to keep it pretty peaceful. So thank you. We look forward to hearing your analysis.
Thank you, Madam Chair. Good afternoon. My name is Connor Brown, Policy Analyst with the Department of Legislative Services, here to present the fiscal 2027 budget analysis for the Maryland Commission on Civil Rights. For context, MCCR investigates civil rights violations and works to increase awareness and understanding of discrimination and solutions for addressing it. To begin, on page 1 of the analysis, the fiscal 2027 budget for MCCR increases by about $517,000, or 7.5%, bringing the total funding to $7.4 million. On page 2, Exhibit 1 shows an overview of agency spending in fiscal 2027. Approximately 88% of the budget supports personnel, which include 49 regular positions, as well as 3 contractual full-time equivalent positions. Moving on to page 3, Exhibit 2 outlines line item changes in the fiscal 2027 allowance compared to fiscal 2026. The primary driver of MCCR's budget increase is personnel expenses, which increased by around $547,000. Helping to offset increases is the abolishment of an administrative specialist position. Continuing on page 4 is the personnel section. In fiscal 2026, 12 positions were added to the budget to help address ongoing case processing challenges that had been attributed in large part to staffing limitations. The 2025 JCR requested a report from MCCR on the impact of these additions, and in their December response, the Commission stated that at the time of writing, 7 of the 12 positions had been filled, and MCCR was working on filling the remaining 3 new positions. 2 positions were being held vacant to meet personnel expense reductions in the fiscal 2026 budget. As of December 31st, MCCR had 8 vacant positions, which include the administrative specialist position that is being abolished in the fiscal 2027 allowance. MCCR should comment on any planned recruitment efforts for vacant positions. On page 5, the key observations section discusses recent patterns in civil rights inquiries and complaints. Exhibit 3 shows that civil rights inquiries received and complaints received by processing by fiscal year. In fiscal 2025, both inquiries and complaints received for processing increased compared to fiscal 2024, both reaching recent highs. On page 6, Exhibit 4 outlines unassigned cases by case type. In fiscal 2025, the number of unassigned cases increased by about 73% compared to fiscal 2024, and all were employment cases. In their JCR response, MCCR attributed this primarily to the volume of employment cases versus other types, and reported that at the time of writing their response, the number of unassigned cases had dropped to 498, a 13% decrease from the end of fiscal 2025 in June. On page 7, Exhibit 5 shows open and pending cases by case type. Employment cases made up approximately 58% of open and pending cases in fiscal '25, housing at 39%, and public accommodations at 3%. Almost all growth in open and pending cases between fiscal '24 and '25 was in housing cases, which grew by 17%. On page 8, Exhibit 6 shows the number of cases open over 1 year, which includes both open and pending cases, as well as unassigned cases that exceed 1 year since being opened. Employment cases represented 84% of cases open over 1 year in fiscal 2025, and the number of employment cases in this category was up about 37% compared to fiscal 2024. This feeds into Exhibit 7 on page 9, which outlines average processing times by case type. Benchmarks established by MCCR target an average resolution time of 180 days or fewer for employment and public accommodations cases and 100 days for housing cases in line with HUD standards. However, as you can see in Exhibit 7, MCCR has not met those benchmarks any year between fiscal 2021 and fiscal 2025. While average processing times for public accommodations cases decreased by around 35% between fiscal '22 and 2025, average processing times for housing cases increased consistently during that same period. Average processing times for employment cases had been declining each year from fiscal '22 to 2024, but they increased significantly in fiscal 2025 from 350 days to 531 days. MCCR attributes this increase in part to the amount of time between case opening and initial interviews with complainants. In that JCR response, MCCR also discussed additional efforts being made to reduce case backlogs, which are at the bottom of page 9. MCCR is rolling out a new customer management system in calendar 2026, and they're relaunching their alternative dispute resolution system, which allows for some cases to be resolved through mediation. Finally, on page 10, the Department of Legislative Services recommends adopting committee narrative, requesting that MCCR submit a report discussing measures implemented to reduce case backlogs. And with that, I conclude my presentation, but I'm happy to answer any questions that you might have.
Well done for your first one, sir. Good job. Any questions for our DLS analyst? Come on, all the lights aren't lighting up? Come on, that's why we do it. Yeah, all right. Thank you so much for your thorough work.
Thank you.
Yeah. We'll now ask Executive Director Horton to join us at the table with his team, and we look forward to hearing your response. Thank you. Welcome.
Thank you, Madam Chair. So, good afternoon, everybody. I am Cleveland Horton. I do have the pleasure of serving as the Executive Director for the Maryland Commission on Civil Rights. So I do want to say good afternoon to the members of the House Health and Social Services Subcommittee. I also want to thank you all for this opportunity to respond to the DLS analysis for fiscal year 2027. We want to thank our first-year analyst, Mr. Connor Brown. As we indicated to him during our Senate budget hearing, he is our favorite analyst at this point in time, even though we know that some of our former analysts are also in the room. That is no shade towards them. So I do want to acknowledge the staff that I have with me today. To my left, I have our Assistant Director, Ms. Nicolette Young, and to my right, I have our esteemed Deputy Director, Ms. Yolanda Saunier. I also just want to take a brief moment of privilege to acknowledge those other staff members who have traveled with us here today that are seated in the gallery. Our Education and Outreach Director, Ms. Candace Crenshaw, my special assistant, the one that keeps me on track and busy all the time, Mr. Spencer Dove, and our long-tenured General Counsel, Ms. Glendora Hughes. And I do want to just show a level of appreciation to her. She's been with the state over 40 years. So I do want to make sure it's on the record that we've shown our appreciation, because I simply do not know how many more times I want to have the opportunity to do so with her. So I just want to show her a level of gratitude that she's well earned that. I just briefly want to talk about a couple of our successes that we've had over the last fiscal year and some of the challenges that our agency continues to face, like many other state agencies. But I'll just start with some of our key successes. We have created a higher level of increased accountability and transparency. As you all may or may not know, we have eliminated our historical practice of not sharing information between the parties. We felt like there was a need for higher transparency and accountability through many of our processes. So we have created a process so that when folks do file complaints with our agency, as they're submitting documentation and information to our agency, we are sharing that information to the parties to allow them to more accurately respond to complaints of discrimination and the information that may refute or dispute the claims in any particular complaint of discrimination. We've also improved our professionalism and our culture. You know, one of the things that we know that as we continue to talk about how we become better, more efficient, and more effective, it does start with our leadership team. So we've strengthened our leadership structure, focusing on leadership development and training. We've truly rebuilt all of our internal morale around our mission, our purpose, and the need for us to serve at a very high level to serve the citizens of our great state. We've seen a growing sense of community trust within the community. We've taken our agency from just being an agency that sits behind the walls of our building, and we've embedded our agency back into the community. So we're doing more education and outreach events. We're engaging folks in more conversations, which is also, we're seeing that as a tremendous growth in the community trust for our agency. Also, we've done a number of operational improvements. We have more consistent investigative standards to ensure that our investigators are consistently investigating our cases at high quality, right? So even though we're here in our great state of Maryland, I like to steal the quote from Mike Tomlin. We always say the standard is the standard, right? And we want to make sure that as an agency, we continue to investigate cases at a high level regardless of the number of cases that we see coming through our agency. As a result of that, as indicated by Connor in his analysis, we have re-implemented our ADR unit, alternative dispute resolution, which is allowing us to have mediations for a number of cases and resolve them a lot faster than we normally would, and allow us to address the backlog that we currently see. Through the implementation of that so far, we've been able to retrieve over $500,000 in monetary relief for victims of unlawful discrimination and drive down some of that backlog. So as we continue to roll out our ADR unit, offer mediation to more of our cases, we do expect that that will have a significant impact on the number of cases that we do have currently sitting in backlog status. Some of the challenges that we continue to face, obviously from a staffing standpoint, we are seeing more cases coming in than we have staff, right? We, as indicated in Connor's analysis, the number of inquiries continues to rise. We reached the number of inquiries for last fiscal year already halfway through the year. So we anticipate that we will double the amount of inquiries that we've had last fiscal year. The last time we saw this significant increase, inquiries was in 2016, right? Same administration, same result. So we are, again, looking at different ways and how we can address the complaints coming in, because it creates a backlog on both ends, right? So it creates a backlog from an intake perspective in reference to how fast we can get the inquiries in, schedule them for an intake interview, and get them in the system. And then it also creates a backlog on the back end when we're waiting for cases to be assigned because we simply don't have enough investigators to handle the caseload that we have. So when you take a look at our time and process, although our numbers are significantly high, it's important to know that those numbers encompass the entire process, from the time that you contact our agency to the time that we resolve the complaint, either a written finding or a settlement. And between that is a number that we focus on, which is the time it takes once it's assigned. So it may spend, right now, it may spend anywhere from 140 to 200 days in the intake backlog waiting for an intake interview. And then once we do the intake, there's another kind of queue waiting for it to get assigned to an investigator. That alone can take anywhere upwards to 300 to 350 days. So once you reduce that number away from our time and process, most of our investigators are completing cases within our internal benchmark, which is about 180 days for the majority of our complaints. I feel like that's key to note. So when you're taking a look at our time and process, there's a way to kind of spread that out to truly understand how long it's taking us to get through our process. Again, the timeliness pressures, when we think about the fact that we know that each case that comes through our agency is important to every individual in that case file. it's important for us to make sure that we can respond to complaints in a reasonable time frame. We are tremendously appreciative of the 12 pens that we got last session. We were not able to, based off of the turnover that was applied to our agency, we could not hire those individuals before October the 1st. We began the process of recruitment to hire those positions, and then the federal government shut down. So a number of the individuals that we had selected for those positions could not officially retire or resign from their federal positions, so there was a delay in us being able to hire some of those vacant positions that we had. Currently, we have 3 vacant positions that we expected to be filled within the next 30 to 45 days, so we're excited to have a full complement of staff for right now. So I'm always nervous about saying that, because as soon as you say you have a full complement of staff, I might get back to my office and that may change. Outside of that, I would say, I think you all know why it's important to invest in the Maryland Commission on Civil Rights. Our job, when we are properly funded, cases move faster, resolutions are made more durable, the litigation costs for discrimination complaints is reduced, and communities experience real impact, right? So our job during this difficult time, this uncertain time, this very divisive time, is to continue to show up for the citizens of our great state and make sure that their rights are protected each and every day, and that's what we do. So we appreciate the analysis. In closing, we thank each of you for your time and consideration, and we ask for your support in the allocation and the governor's allowance for fiscal year 2027.
Thank you so much for your response and for being here today. We appreciate the opportunity to hear updates on the important work that you're doing, especially in light of some of the extreme challenges that we're all facing because of changes at the federal level. I want to turn it to my colleagues first to see if anyone has any questions. I see Delegate Ruff is lighting up his mic. Go ahead, sir.
Good afternoon to all of you, folks at the MCCR. Much appreciate you and your work, as you know. Got a chance to fill in for Senator Alsobrooks at your gala this past year, so that was a stroke of luck for me to be able to join you for the fireside chat that we had. And I just want folks to, if I could just take a second, Madam Chair. I just want folks to have a real understanding of who you are, Mr. Horton, because you gave us opportunity to see who you really were at that gala by honoring your team. And the way you honored your team really touched my spirit. It really speaks volumes to why it is that you've been entrusted with this great and very important work on behalf of Marylanders. So very, very proud of you.
Thank you.
I know your team is very proud of you.
Thank you.
And we just appreciate you standing on that wall and getting the job done with to the best of your ability. So
Thank you.
I just wanted to lead in with that and say many thanks to you and much appreciation for being involved in your gala. I know we're going to talk about that today as well, so just a little precursor. But I'll start with looking at the reduction in your turnover rate, which has been noted by DLS. From 10.63% to 6.51%, which I think suggests that your agency is stabilized as far as the workforce is concerned, or at least getting close to stabilization. It appears that filling civil rights officer and attorney positions, these frontline investigative and legal positions, has contributed to that. But could you, from your own perspective, tell us, which positions drove the increase and how that is working towards you guys, as you just kind of mentioned, getting stabilized and getting back to full force?
No, absolutely. I think so. For us, it's hard to compete with the private sector. For us, with civil rights officers and especially our legal positions, just based off of pay. Our folks, because we're on the front lines, I always say that our folks are getting recruited and exposed to other organizations day in and day out, and folks are using our agency as a recruiting ground, right? So that they can pull our folks out which increases our turnover because sometimes we're constantly turning over investigative positions. And I would say just when we think about the work as a whole, there are a number of folks that learn about civil rights, and it sounds beautiful and it sounds sweet to say you're a civil rights officer, that you are fighting the good fight. But behind those doors are tables and offices full of cases, right? And people constantly calling because of the cases, and rightfully so. So there are a number of individuals who want the accolades of saying they work in civil rights, but not truly understand the work that goes behind doing the work in civil rights. So we've had some open doors consistently with our investigative positions because it's difficult. You are thrust into the middle of conflict each and every day, right? Every time you get a case, it's conflict, right? Whether it's actualized or not, it's conflict to one or both of the parties. And that conflict creates a high level of stress. And some individuals who get into this profession to do the work just don't realize the level of stress that it takes to be a civil rights officer. And in this time, right, where I tell folks that some folks have the ability to go home, turn off the TV, turn off the noise, right? But when we wake up every day, we turn the noise on and it stays on because it's a part of our job. And it's our job to respond to it and ensure that we're protecting individuals. So part of our difficulty has been trying to retain folks and keep individuals within the agency because, again, once we're able to train folks and they show a certain level of competence, they are being recruited out. Before, it used to be the federal government was our biggest competitor, where they were picking our employees off, paying them more, asking them to do less. Now what we see, obviously, because of the current administration, it's a little different. So our biggest competitor right now is the private sector. But we still find it very difficult, for instance, when we're trying to fill our legal positions. We have a number of qualified, talented people that want to come work for the Maryland Commission on Civil Rights, but they don't want to come work for the Maryland Commission on Civil Rights at the salary that we can offer them. So that makes it more difficult to fill positions when they're vacant, which also adds to our turnover percentage.
Well, I think I noted that in our hearing last year, that we all together need to figure out how to create some private-public partnerships amongst the civil rights bar, which is pretty limited, as I know.
Yeah.
There are not a whole lot of civil rights practitioners out there, but there needs to be a way to figure out how to help you in that retention area, because without the top talent addressing the very nuanced legal issues that you all are looking at, you're going to be fighting with, at least partially one hand behind your back. So I think we should all be able to figure out how to commit to assisting you with that retention issue. And just, if I may, Madam Chair, just briefly touch on a tangential subject to say, and I know we'll be getting into backlog issues and case load issues. My specific question about that is, how is that affecting your timelines and deadlines related to the rules of procedure and process that may be associated with some of the cases that you guys may be bringing, or at least teeing up for folks to bring in the state and federal courts?
No, that's a great question, and I'll do my best to answer it. And I know our general counsel probably is up there squeezing her hands trying to figure out what I'm going to say. But I do welcome her. If I don't explain everything, she can feel free to come down and join us at this table. But I will say, typically what happens is, so when we go through our process and we get to the point where we've issued probable cause and we know we're at the point where we're going to litigate the case, there's a conversation that we have with our legal team to see if they're ready. If they're ready to move forward so that we don't miss any deadlines or timeframes. So what will happen is we get to that point and we'll hold the case until our general counsel says, hey, we have an attorney that's free and ready and can take the case and move forward to ensure that our cases don't get dismissed on a technicality because we've missed a deadline or a time frame. So we have a couple different queues, right? So I mentioned we got the intake queue, we got the investigative assignment queue, and then once we issue probable cause, we have the legal queue where our cases sit and wait until we have the legal representative ready to move that case forward so that we can address it appropriately and there's no delay with the time frame standpoint.
Thank you very much, Madam Chair. Thank you guys so very much for all you do.
Thank you.
It is so helpful to have a civil rights attorney here on the committee to know to ask these types of questions. I had a similar one that, like, honestly was not nearly as intelligent, so I really appreciate that. Delegate McCaskill, next question.
Thank you, Madam Chair. So I just want to say Happy New Year to you all. And although it's a new session, I think of you constantly. And I'm always prayerful for you all, especially in our current administration. And so I just want to also say thank you. A point of privilege, Madam Chair. I also want to say to my colleague next to me, now I understand at the gala why I was uninvited for Angela also. So we'll have to have a further conversation about that because I see someone else was at the head of the table. Thank you, Madam Chair. I do have two questions in reference to, I'm looking at page 9 in DLS report. And so in your response, in your notes, you note your new approaches are being applied, such as the alternative dispute resolution.
Yes.
Are there any other new approaches you are using to tackle the backlog as well?
Great question. So there are. So we are, and we've been working with Do It in reference to leveraging AI. And we say that we're not using AI to reduce the number of employees we need. We're using AI to assist the employees that we do have. So from an intake perspective, we are using that to take the PQ, which is the preliminary questionnaire that folks submit online, and the AI will take that and then formulate it into a Form 5 form for us, which is our official complaint form for complaints. That saves us some of the administrative work up front. Staff then will still have an intake appointment, but really it's instead of asking more of the open-ended questions that cause the intake interview to be quite lengthy, we are simply verifying and confirming the information that they submitted on the PQ that's now on the Form 5 to make sure that we have it all correct. And then now we're able to get that into our intake queue a lot faster. The same thing from an investigative standpoint, we're leveraging AI to record our interviews, right? And allow it to then summarize and provide us the information. We still have our staff verifying that information and confirming that the information is correct. But it is allowing us to reduce some of the administrative burden that we have in between our processes. So we're trying to figure out at all possible when we can leverage AI to help us become more efficient, to kind of work through the backlog a lot faster. We are doing that. So we are really trying to utilize our technology at a high level. We think then again, as you mentioned, that ADR, we've only offered it right now to a limited subset of the cases that we have. But now we are about ready to open it up to all the cases, and we are confident that that will continue to provide a significant help with reducing the backlog. We expect that the 12 pins that we were able to get will also serve great dividends for the backlog, but it is key to note, even when we talk about the 12 pins, that not all 12 pins went into investigator positions. So I believe that's key to note, right? So we were able to, some of the pins went to our legal department to allow us to have additional resources from a legal standpoint, right? Because we're trying to figure out how we address the different queues and backlogs that we have at different points. So it was important for us to allocate the pins in a way that would kind of free up some of those backlogs at each point. Some of those pins also went to our intake unit. So right now we have more intake officers than we've had in the last 15 years. And we're doing that so that we can make sure as the inquiries continue to increase and we bring them in, we can try to bring them in as fast as we can to address that backlog too.
I appreciate that. So it's really good to know that we can use AI responsibly, and I'm glad it's working, for your benefit. Just out of curiosity, how many additional staff would you require to eliminate your backlog entirely?
That's a great question. We probably, we had this conversation daily, if not hourly at times, to talk about that. We're probably looking at somewhere between 75 to 80 staff as a whole in order for us to address the entire backlog and to be able to keep up consistently with where the work is. And the reason I referenced 2016 is because in 2016, we saw a doubling in the number of complaints that were coming into our agency. The work never decreased, but we didn't double staff, right? We also see that again now where our inquiries are doubling again, so we anticipate that it'll stay at this level as well. as it continues. And I do want to give a special shout out to our E&O team. A part of the reason why we're getting so many complaints is because of all of the education and outreach events that they're doing throughout the entire state. Some of our pens as well, some of those 12 pens also went to expand our E&O team. We only had 3 individuals in our education and outreach team before. We now have 6. 3 to cover the entire state just simply wasn't enough. We were turning down more training and education and outreach events than we were accepting. So we did allocate some of those pens to our E&O team as well. And as a result of that, more folks are becoming aware of us and aware of what their rights are and filing more complaints. We just want to make sure we have the right staff in place to be able to address that in what we consider to be an acceptable time frame.
Perfect. One more question, Madam Chair, if I may. So back to page 9 again. I was reading how with your alternative dispute resolution program, that it's new and you relaunched it,
Yes, ma'am.
if you will. And so my question is, can you describe what previously caused the program to cease operations?
Yep. Sure. So previously, when mediation first hit the scene, mediation was the hot topic, right? Everybody wanted to go to mediation and see if they could resolve the complaints. Part of what we saw as the issue through our initial iteration of the mediation program was the style of mediation that we were using. It was more of a family-style mediation where they were asking people about their feelings. How did you feel when this happened? How did it make you feel? And both parties were letting us know, look, we're not coming here to talk about feelings. We want to know whether it was a violation or not. So slowly what we began to see is less and less people opting into our mediation program, is which while we shifted to what we still have in place, which is our fact-finding conferences, which is kind of a blend and a merge between investigation and mediation. We bring all the parties together, we talk about the case, and then at the end of the fact-finding conference, folks have an opportunity to talk about settlement, and that's our fact-finding conference. Now, through our alternative dispute resolution, we are doing more of a facilitative model of mediation, and we're very selective on who we're allowing to be our mediators and who we select as mediators to make sure those folks are trained in what we do and how we do it, so they can speak more directly to the issues in the complaint about the potential violations or not. And the parties have been way more receptive to that. And again, I believe that even so far, even in a limited time frame, the alternative dispute resolution program, that iteration that we have now, has shown its dividends, and while we've been able to retrieve over $500,000 in monetary benefits so far.
Perfect. Thank you, Madam Chair, and thank you all for continuously working with less, but doing so much more. We appreciate it.
Thank you.
Thank you, Delegate. Thank you, friends. Delegate Stonko, I can't see if you're, yes, okay, Delegate Stonko.
Thank you, Madam Chair, and thank you all for being here today. I'm getting up to speed, obviously, being new to the subcommittee and hearing a lot about the gala. Would you mind sharing the $85,000 that's provided for the gala? How's that allocated inside of the gala? And then could you just walk me through the economics of the gala as well? So do you work with sponsors? How successful has that been if you do work with sponsors in raising, and then kind of your net economics? So do you walk away being kind of net positive in contributions from the gala?
No problem. Thank you for that. I think the gala is always a point of question, so we do appreciate always the opportunity to talk about our gala. First, I just want to say that the purpose of our gala is always to highlight and recognize those individuals within our state who have made great strides to promote and improve civil rights throughout our entire state. And we use our gala as our biggest education and outreach event to be able to do so. So we bring folks from around the state together to really talk about pertinent issues. As you heard Delegate Ruff speak to the fact that he was one of our guests to sit on our fireside chat in our most recent gala, it really gives individuals the opportunity to hear about the issues, hear about what we're doing, initiatives, not just from the Maryland Commission on Civil Rights, but for other individuals as well who are doing their best as well to address and improve the civil rights landscape throughout our entire state. So the $85,000 that you typically see that's allocated to our budget is what we request in the budget amendment to be able to spend the funds for the gala. That includes the sponsor donations that we get from sponsors, and we always typically raise anywhere between $40,000 and $50,000 from private sector sponsors for the gala. We typically, in past years, have been able to get sponsorships from the Equal Employment Opportunity Commission and the Department of Housing and Urban Development. As you all probably know, those sponsorships are not as readily available during these times. But we continue to go out and seek additional sponsorships as a part of making sure that the agency is not covering the bulk of the expenses for the gala. We've also working with nonprofit organizations that can assist us in allowing other private sector donations from banks, things like that, who are required to be able to write it off as a tax deductible donation. We do work with nonprofits to be able to do that, to make sure that we cover the cost of the gala. Typically, our gala has not been a fundraising event for our agency. Our goal has always been to, whatever money we bring in, that's the money that we spend on the gala. Some years we've been successful in that. Some years our agency has covered some of the costs for the gala. But for the most part, we do our best to at least break even on the gala. We are shifting that model as well to create more of a fundraising opportunity for the gala, to allow us to provide funds not just for the direct work that we do, but also to provide additional services and programs for our state, via scholarships and things like that for the youth. So we do work with the Maryland Commission on Civil Rights Foundation, which is a nonprofit that is created to accept those donations and provide different programs and services, especially to the youth, as we continue to move forward. So we are shifting to more of a, how do we create an environment where it can be more of a fundraising opportunity for us to be able to do that.
Thank you.
No problem.
Thank you, Delegate. Thank you, Mr. Executive Director. Any further questions from my colleagues? Okay. Just as a heads up, I have a lot of trouble seeing microphones. If you do in the future have questions, just like turn around and wave at me. Thank you so much. I think that concludes our questions for this this briefing. We really appreciate your work, and as we continue to review your budget, you may hear from some of us privately, and we will look forward to our work together.
Thank you. I just want to add too, I know last year Delegate Ruff was in attendance at our gala, so we're expecting this year that all the members of the subcommittee will be present. All right, so I thank you all for your commitment to that.
Thank you.
Thank you.
Thank you so much. Okay, as noted, we don't have any witnesses signed up for this particular agency budget, and so we'll go to the second one on our agenda, which is the Maryland Institute for Emergency Medical Service Systems. And always, we will begin with our budget analyst, Ms. Naomi Komoro. Thank you so much in advance for your thorough analysis, and we look forward to your report.
Thank you, Madam Chair. My name is Naomi Komoro. I am the budget analyst, and I'm going to be presenting the budget, fiscal 27 budget for MIMS, or the Maryland Institute for Emergency Medical Services Systems. So as you can see on page 1, the fiscal 27 allowance grows by about $1.1 million for MIMS for a total budget of $26.6 million. On page 2, we summarize some of the grants that were thought to be at risk from recent federal action, but also note that MIMS did not lose any federal funding from these purposes in fiscal 25 or fiscal 26. On page 3 is the breakout of the fiscal 27 budget for MIMS, showing the different categories of spending. A majority of the budget is dedicated to personnel. And then about $4.5 million goes to the telecommunications and IT expenses, which helps support MIM's robust communication system throughout the state. On pages 4 and 5, we summarize the major changes in the budget between fiscal 26 and fiscal 27. Again, the total budget is growing by about $1.1 million, and that's driven by an increase in telecommunications costs. MIMS has had to replace 10 microwave links that are outdated, which support data transmission for their communication systems. There's also an increase of about $515 million due to health insurance costs, which is consistent with rising cost of health insurance that you'll see in other agencies as well. On page 5, we summarize the changes in personnel. MIMS didn't have any changes in regular personnel between fiscal 26 and fiscal 27. They did eliminate one position through the voluntary separation program, which equates to about $80,500 in savings in fiscal 26. And then in terms of vacancies, as of December 31st, MIMS had 10 vacancies, which is 4.29 above the amount needed to meet the turnover that they have budgeted for. MIMS indicates that of these 10 positions, 2 have been filled, 2 have offer letters out, and the rest will be submitted for recruitment over the next few weeks. On pages 6 and 7, we've written about some of MIMS's efforts to fulfill recent pieces of legislation related to placing AED and naloxone in public places, and just describe how MIMS has worked with other agencies to do that, and also note their development and maintenance of their AED registry. And finally, DLS concurs with the governor's allowance, and I'd be happy to take any questions.
Thank you so much for your analysis and presentation. Do any subcommittee members have questions for our budget analyst? Oh, for the budget analyst.
No, I don't.
Thank you. Thank you, Ms. Comoro. We will now turn to the agency representatives. So we have Dr. Delbridge, Executive Director, and team. Thank you so much for joining us. We look forward to hearing your presentation. It's a much bigger room than last year, right? So it takes a minute. Oh, no. Yeah. Well, we know we have a strong MIMS system to call, right? So, all right. Thank you, sir. Appreciate
Good afternoon,
it.
Madam Chair. It's great to see you
Good
and
to see you.
members of the subcommittee. Thanks very much for having us. I'm Dr. Ted Delbridge. I'm the Executive Director of MEMS, the Maryland Institute for Emergency Medical Services Systems, and I'm joined by my Chief Administrative Officer, Kelly Hammond. If it's okay, I'd like to provide a quick overview of MEMS. We're an independent state agency that coordinates all components of the statewide emergency medical services system. We do that by providing medical oversight, promulgating statewide clinical protocols that are used by the EMTs and paramedics in the field, coordinating and supporting EMS educational programs, licensing and certifying EMS clinicians, maintaining and operating a statewide communication system that Naomi referenced, designating trauma and specialty centers, and licensing and regulating commercial ambulance services. We appreciate the comprehensive analysis by Naomi Kumiro, the DLS analyst, and I'd like to also acknowledge our DBM analyst, Christina Jorge-Tunyan, for her help. We concur with Naomi's analysis and her recommendations. By way of a couple of things that we continue to work on, we are continuously focused on the EMS to emergency department transfer of care interval, the amount of time it takes for a hospital to accept responsibility for care of a patient that the EMS clinicians are bringing. We provide updated reports weekly to hospital and emergency department leaders, the EMS system, and also supply monthly reports to the HSCRC so that they can continue to encourage continuous improvement in hospital emergency departments. This is an important consideration because it's what limits or keeps available EMS resources in the communities that they're there to serve. During the past year, we launched the Emergency Department Advisory System, or EDAS. It's a web-based platform that provides 4 pieces of information that are valuable as we try to keep the emergency medical service system functioning and level set hospital receipt of ambulance traffic. One is an indication of the current patient census relative to the emergency department's established capacity. 2 is an indication of the number of ambulances that are currently en route to that particular emergency department. 3 is the number of ambulances that are currently there and how long they've been there. And the 4th thing is alert status, indicating that a hospital is unable currently to accept current sorts of patients, for example, trauma patients or cardiac patients, so that we take those people to the right place where they can get the appropriate expedited care. Early last year, we rolled out updated automatic external defibrillator registry. The new AED public access registry is designed to accommodate changes in the law that required AEDs in grocery stores and restaurants with stipulations about the requirements for staff at those places, and also to accommodate reconciling where naloxone is co-located with an AED relative to 2024 legislation that passed that was requiring certain AEDs in public places to be co-located with naloxone. Currently, there are more than 17,000 registered AEDs in Maryland, and 1,380 of them, as of the other day, are co-located with naloxone. We continue to work, as Naomi pointed out, with the Maryland Office of Overdose Response in order to secure the naloxone and funding for the project. We're focused on an October 2027 deadline to make that happen. And of course, we continue to designate hospital specialty centers. In Maryland, there are trauma centers, pediatric trauma centers, a hand trauma center, an eye center, adult and pediatric burn centers, 24 cardiac intervention centers, and 38 stroke centers, as well as perinatal centers. We're spending this upcoming year in preparing to designate hospital emergency departments based on their capacity to manage pediatric cases as well. And finally, I'd be remiss if I didn't acknowledge the heart of the EMS system, which is 20,000 EMS clinicians, emergency medical responders, emergency medical technicians, cardiac rescue technicians, and paramedics. During the past year, they responded to more than 1 million calls for help. They transported safely 586,000 people to Maryland hospitals and emergency departments. In the past year, we've credentialed 1,895 new emergency medical technicians and 290 paramedics. Those are just a few of the things we're working on. Thanks for your indulgence, and I'm happy to answer any questions. And if you ask me really hard ones, I'll refer them to Kelly.
Thank you so much for your presentation and your response to the DLS analysis. Do we have questions from the subcommittee? Yes, please, Madam Vice Chair, you go first. Thank you.
Thank you so much. I'm going to apologize for my voice in advance. One of my questions, there's a proposed 46,000 cut to the budget for supplies and materials. There's also the potential threat with funding from federal grants, like the Metropolitan Medical Response System grant, which states, and I quote, supports the efforts to strengthen local capacity to respond to mass casualty incidents. Could you explain what constitutes supplies and materials, and are they life-saving materials such as those involved with the Metropolitan Medical Response System or the AED public access? And again, I apologize for my voice. I've lost it.
I'll let Kelly start that one, and then I'll pick up.
Okay, some of the supplies and materials, it's a reallocation of where the funding was actually used within the program. So for instance, one of our grant programs is EMS for Children, and so they buy car seats and different things like that. So it's a realignment of where it was more towards like maybe equipment than supplies and materials, or for, you know, different kind of training material. You know, it's, as I said, a realignment of more of what it actually is than supplies and materials. So when they put in for the grant with the government, it's recorded in a certain way, and we record it the same way, but it may not actually be spent there.
And to answer your question more directly, beyond the nuance of where it's allocated, it's not life-saving materials that we're talking about. It's not something we're lacking to do our job. The other part of that is the federal grant money supports an effort that is focused principally on Prince George's and Montgomery counties as part of the National Capital Region, the Emergency Response System. That grant, that funding is in jeopardy. We are watching it closely to make sure that we don't overcommit resources to an area that's going to lose funding. They're currently operating with an expectation of functioning through October of 2026.
Okay, thank you very much. Vacancies, can we talk about that just quickly? As of the end of the year, 2025, just under 10% of personal positions were vacant. However, there's an anticipated 1.74% increase in personnel for the fiscal year 27. This is a proposed $689,000 funding increase. That's where that goes towards. There was an increase from fiscal year 25 and fiscal year 26. However, the anticipated increase for 27 is smaller than that charge. Can you explain to us, is there a particular reason for the prediction of a lower increase for 27? And is this in any way related to the almost 25,000 federal job losses in Maryland in 25?
Go ahead.
Okay, so part of the funding is used to cover, so if you remember during the last legislative session, there were cost containment measures. So part of our cost containment measures are being taken out of salaries. So what we're doing is holding positions open longer to cover those cost-cutting measures. We did give up one position towards the VSP. However, because we can't really afford to be without our positions permanently, we've chose to keep them open for a longer period of time, if that makes sense.
It does. Thank you so much. Thank you.
Really good commitment there, Madam Vice Chair, despite not having a voice, getting your questions in. Good job. Delegate Ruff.
Thank you, Madam Chair, and thank you to both of you. Wanted to just ask two quick questions, but certainly thank you for everything that you all do, the way you operate and provide life-saving care to our state. There's just no amount of words that we could offer you to properly thank you. So just want to lead with that. Now, I wanted to talk about the note that you made about the transfer times between ambulances to ERs, the emergency departments, having improved. Are there any specific targets that you can commit to achieving, or at least tell us about that you have as goals for this coming fiscal year as a result of the appropriations from this budget?
We're focused on that transfer of care interval being 35 minutes or less 90% of the time at each individual hospitals. Over the past, probably about 48% of the hospitals are able to accomplish that on a reliable basis. Our commitment is to continue to remind hospitals of their obligation, and when they require technical assistance, asking us for that assistance. We don't have the capacity to reach inside the hospitals and change their capacity and their approach to managing the influx of patients. Our effort this past year had to do with the Emergency Department Advisory System to alert the EMS community who's en route to a particular hospital what to expect when they get there and to make patient care destination decisions the most reliable. I think our commitment is to continue to do that. The extent to which we can facilitate improvements is really sort of limited capacity, only because we can't control what happens inside a hospital once patients arrive.
Fair enough, and I think that sounds very reasonable and high enough, as far as a goal setting. I think that will adequately serve Marylanders. The other question I had was related to the naloxone co-location requirements. You stated, and I'm glad you talked about the October goal of 2027. And so can you kind of give us an idea of what potential consequences there could be if you all are unable to meet that goal, and then where do you expect to be at the end of fiscal 27 on the way to that goal?
Well, first of all, I'm committed to making that goal, so I don't think there won't be an issue of not getting there. End of fiscal 27. At the end of fiscal 27, we should be well on our way. Our approach to that project has been severalfold. One is acquiring the naloxone to be able to distribute to places where those AEDs exist, and that's happened. We are the beneficiaries of funding from the Maryland Office of Overdose Response and MDH. We actually possess a great deal of the naloxone we need to make that happen. Secondly, we identified a person who was already on our staff who has taken this on as his focus of work in order to identify those AEDs which are the focus of the effort. Those are AEDs in places of secondary education or higher, recreation facilities supported by tax dollars, and public transit system depots where there are AEDs that are supported by tax dollars. Those are what the focus of the prior legislation was about. So we are working with community leaders throughout the state to identify where those AEDs are and make sure that they have naloxone co-located with them. That was part of our AED registry modification during the past year, was to make sure that we can track where naloxone is co-located with AEDs and make sure that we could categorize the location of AEDs consistent with the law.
And so are all 17,258 registered in the state required to have the co-location? Or-
No.
Yeah, so that's what I was trying to be more clear on. Kind of, I guess, what percentage or what amount of that number do you guys actually need to address?
Yeah, we don't know. That was a point brought up when the legislation was being contemplated, that we didn't have an idea. We guessed 4,000. I think that's probably an overestimate. And part of the job of our AED coordinator is to reach out into communities and figure out exactly how many AEDs there are that are qualified for the naloxone co-location. We've had a lot of people come to us and say they want naloxone to be co-located with their AED, and they weren't part of that particular focus. We refer them to local health departments and other sources to get naloxone, but we're interested in identifying those AEDs that are in those places that are subject of the law. The AED registry helps us some. When people register an AED now, they're prompted to provide us that information. To go back to the 17,000 that already exist is a challenge, and that's what we're working through. We've already gotten great response from the school system through the Maryland School Safety Initiative to identify AEDs in various school districts and begin to co-locate naloxone with them.
Very well, thank you so much.
And we know, by the way, that I think I mentioned, among the 17,000 AEDs, 1,380 of them already have naloxone co-located
Yeah.
with them.
We got that noted, but happy hunting.
Thank you.
Thank you so much, Delegate. I have just a quick question, please, related to the trainings and conference budget. I know we had a bit of a discussion on this last year as well, and that you had noted that there was some federal funding received to cover some of the portion of that. I also see that there's a bit of a decrease in the FY27 budget for trainings and conferences relative to 26, but it's still, $972,000, which is a pretty sizable chunk of the budget. So I just wanted to ask if you don't mind sharing a little bit more for the record on how you plan to spend these resources, what types of trainings and conferences you all need to participate in. Thank you.
The vast majority of that.
And can you speak into the mic? It's really hard to hear you, sir.
Sorry. The vast majority of that has to do with the emergency response system that's supported by federal grants, and the training and conferences that they are funding aren't related to MEMS personnel. It's for law enforcement and fire department and emergency management personnel in those jurisdictions that are the focus of the ERS. The MEMS part of conferences and such that our staff go to are really quite limited, and it's something we pay close attention to make sure that we're not overspending. Do you have an idea what that number is? I would be happy to provide you in follow-up a more detailed analysis of that information, if that's okay.
That would be great. Thank you, sir. Any further questions from the subcommittee? Okay, seeing none, thank you so much for your presentation and for the good work that your agency does. I'm sorry, did you have a question? Sorry. We're all orienting to the new space. So thank you so much. We look forward to our continued conversation. Thank you for your good work.
Welcome, thank you.
We'll now turn to our third and final budget of the day, the Department of Aging, and we'll start out with Victoria Martinez from Department of Legislative Services for her analysis. Thank you in advance, Ms. Martinez, for your good work. We appreciate it. Thank you.
Thank you, Madam Chair and members of the committee. My name is Victoria Martinez. I'm with the Department of Legislative Services, and I'm going to be discussing the Maryland Department of Aging analysis. MDOA functions as the federally designated state unit on aging and distributes both state and federal funding to local area agencies on aging, who provide services to older adults such as information and referral services, meal delivery services, and assisted living subsidies. As you can see on the first page of the analysis, the fiscal 2027 allowance decreases by $9.7 million, or 10.6% to $82 million. On the next page, we describe the fiscal 2026 proposed deficiencies. There are 5 deficiency appropriations, providing a total net of $423,410. 3 deficiencies add funds for rent cost, the Senior Call Check Program, and new federal awards, while 2 deficiencies withdraw funds to abolish 4 vacant positions and to reflect the transfer of the Commodity Supplemental Food Program to the Department of Human Services. On page 3, Exhibit 1 shows an overview of the agency's spending for the fiscal 2027 allowance. The majority of the budget goes towards various state and federal funded programs, with the 2 largest shares including 32% for federally funded programs through the Older Americans Act and 24% for the state-funded SOAR program. Exhibit 2, beginning on page 4, shows a breakdown of the $9.7 million decrease in the budget, with two large changes accounting for 93% of this change. So it's mainly due to these 2 changes. The first is a decrease of $6.1 million due to the expiration of ARPA funding, which provided supplemental enhanced funding for Older Americans Act federal programs. The second is a decrease of $2.9 million to reflect the transfer of the Veteran-Directed Care Program back under the administration of the U.S. Department of Veterans Affairs. This program was transferred in fiscal 2025, but was included in the fiscal 2026 budget in error. Exhibit 3 on page 6 shows the various community services programs that are funded by MDOA and mainly administered by the AAAs. The majority of programs were level funded in fiscal 2027 and didn't see any change. Moving on to personnel discussed on page 8 of the analysis. There was no change in the number of regular or contractual positions. When you account for 4 federally funded positions to be abolished through the proposed deficiency, MDOA has a vacancy rate of 12%. Since this is higher than the necessary vacancies to meet the budgeted turnover rate of 4%, DLS recommends increasing the turnover expectancy to 8%, which would result in a reduction of $255,580, which is mainly in federal funds. Moving on to the key observations. The first key observation, beginning on page 9 of the analysis, discusses the implementation of the Supporting Older Adults with Resources program, known as the SOAR program. Exhibit 4, beginning at the bottom of page 9, provides details on the 3 major programs that MDOA operates that support older adults to live independently, which include senior care, senior assisted living subsidy, and the congregate housing services program. Last year, legislation consolidated these 3 programs into one program, the SOAR program, begin in fiscal 2027 in efforts to reduce administrative burden. Exhibit 5 on page 11 shows the funding sources for the SOAR program, showing that the total funding for these programs would remain the same, but they would be consolidated into one funding source. Since the transition planning for the program is still currently underway, DLS recommends adopting committee narrative, requesting a report that provides an updated plan, including how funds will be allocated to AAAs, program eligibility, services offered, and any impacts on legacy participants in implementing the SOAR program. DLS also recommends adopting committee narrative, requesting that MDOA establish new goals and performance measures for the SOAR program to be able to continue assessing the program's performance. The key observation 2 on page 12 provides an update on senior care spending. Although the program faced challenges in spending all funds in fiscal 2024, there was improved spending with only 2% of the total $13.9 million in fiscal 2025 reverted at fiscal year closeout, so they spent the majority of the funds. To assess performance in reducing the senior care waitlist, DLS has asked that MDOA comment on any changes to the number of individuals on the waitlist in fiscal 2025. The third key observation, beginning at the bottom of page 12, discusses the long-term care and dementia care navigation program, which provides support to people living with dementia. Exhibit 6 on page 13 shows the contacts and outreach conducted through the program from the first full year of data on the program. In fiscal 2025, there were over 3,000 direct contacts made, over 3,500 cognitive screenings conducted, and over 600 outreach events conducted. And the last thing that I'll discuss is the last key observation 4, beginning on page 14. This key observation is on the Longevity Ready Maryland Plan. This initiative requires MDOA to develop a multi-sector plan to guide systems transformation over the next 10 years. The 4 objectives of the initiative are to build a longevity ecosystem, promote economic opportunity, prepare Marylanders to afford longevity, and optimize health, wellness, and mobility. The final plan was shared in a report published in July 2025, and the rest of the issue has more information on the implementation of the plan. And that concludes my presentation, and I'm happy to answer any questions.
Thank you, Ms. Martinez. Any questions for our analyst? Okay, seeing none, thank you. We'll now call upon our agency friends. Secretary Roque and team, please join us at the table. And Ms. Martinez, you may join us up here. And we will we'll continue on with this. As a reminder, in our subcommittee, we like to ask our agency partners, when you have witnesses signed up to testify, to please plan to stay so you can hear their testimony so that we can then follow up with you if we have further questions afterwards. So you may begin when you're ready. Thank you.
Good afternoon, Chair Delegate Shetty and Vice Chair Delegate Jones. It's very nice to see you, and committee members. I want to express my deep appreciation to my fellow public servants, our legislative analyst, Victoria Martinez. This is our first year with Victoria. Our DBM analyst, Skylar Knight, and Michael Zomber, MDOA's CFO, for their commitment and hard work drafting the budget I bring before you for your consideration. This budget reflects our continued commitment to the well-being of older people in Maryland and to a longevity-ready future for our state. And I know a longevity-ready future sounds very visionary and inspirational, and it is, but the work of bringing that about is very practical, and you will see that in our budget. This budget also importantly reflects the current environment of fiscal constraint and our commitment to navigate those waters with thoughtfulness and responsibility. I am grateful for this opportunity to work with all of you, our legislative partners, on this critical work in service of the people of Maryland. And on that note, I'm going to ask that our CFO testify on our budget.
Good afternoon, Chair Shetty, Vice Chair Jones, members of the committee. Thank you for the opportunity to testify today on our operating budget. The Governor's FY27 budget for the Maryland Department of Aging reflects a disciplined approach in a constrained fiscal environment, while maintaining the core capacity of the department and the statewide Area on Aging Services Network. At the same time, MDOA continues to operate amid several external challenges, including flat federal funding as the administrative costs necessary to maintain these programs increase, as well as mounting uncertainty at the federal level. These pressures are further intensified by the recent expiration of temporary ARPA funding, which in recent years provided supplemental grant support to the AAA network and additional administrative resources that help stabilize MDOA operations. Despite these challenges, MDOA has demonstrated strong fiscal stewardship over the past year, and the fact that funds allocated to MDOA are funds well spent. In FY25, nearly 96% of state grant funds were expended across the Area Agencies on Aging Network, with 13 of 19 AAAs achieving a 100% spend rate. On the federal side, FY24 Older American Act grants, which expired on September 30, were likewise 96% expended statewide. In addition, the one-time FY21 ARPA grants extended through federal fiscal year 2025 were 98% expended, with 15 AAAs utilizing every dollar of these supplemental funds. Moreover, the federal shutdown this fall, which had the potential to significantly impede services to the state's older adults, was managed by MDOA decisively and effectively. The department ensured the continuity of both the flow of federal funds to support our programs and timely information to the AAA network, providing them with the confidence to continue delivering services throughout the funding lapse. Against this backdrop of fiscal pressures and the department's demonstrated fiduciary performance, MDOA opposes the proposed DLS general fund turnover adjustment that would reduce the department's salary allocation by over $36,000. While seemingly modest, this reduction would have a disproportionate impact on a small agency that over the past few years has strived to maintain a lean and efficient staffing structure, resulting in a current general fund turnover rate of just 3.7% based on position funding allocations in the FY27 budget. Increasing the general fund turnover rate to 6.8% as proposed by DLS could compel MDOA to defer filling vacancies and risk disrupting performance for programs that are critical to Maryland's older adults. MDOA is cognizant of the particularly challenging current fiscal environment in the state. However, as a written response states, we concur with all of the DLS recommendations, except that we ask you to reject the general fund cut of $36,207 that appears on page 16. Thank you.
Does that conclude your testimony?
I think that concludes our testimony, and we are open for questions.
Thank you, Madam Secretary and team. We appreciate the opportunity to speak with you today. Do any members of the subcommittee have questions? Okay, yes, Delegate Heimbach. Yes, sir, please.
Oh, thank you, Madam Chair. Let me begin by saying, as the oldest member of the subcommittee, I appreciate what you all do. And before I ask my specific question, I just want an observation. I'm concerned because we all know that the population is aging rapidly, and the number of people that are 65 and older is going to increase dramatically. And when I see that you've lost the ARPA funding, and now because you've been unable to fill positions, I guess you could lose some more funding, and particularly when you look at the things that go with the aging population, like dementia and all the things that go with all that. I mean, it's pretty obvious that the demand for your services is going to increase. So, and I know you've finalize the, I think it was called Longevity Ready Maryland Plan that I read about, but I didn't, maybe it's there, but I didn't see anywhere where funding was associated with the implementation of the plan. So it looks to me like you just have a really, really big challenge. And part of the way, I think, part of that was within your control, I think, is to do a better job of filling those vacancies that you have. And I think when you came in last year, one of the things that you planned to implement, I think, to address the vacancy rate was to do more upfront research in terms of what were the characteristics and qualities that you were looking for in that job before you advertised. So I actually have a two-part question. If I'm right in my statement that that was a technique you were going to use, how is that working out? And then my second question is, with the loss of 25,000 federal jobs in the state of Maryland, does that represent a pool of people that you could use to help fill some of those vacancies you have?
Thank you for that wonderful question, Delegate, because now I get to talk a little bit about one of my favorite things, which is the extraordinary staff we've been able to put together at the department. So I'm going to just go back for just a sec to the beginning and talk about Longevity Ready Maryland, since you raised that, and the funding issue. One of the reasons why we used the approach of a multi-sector plan, all-of-government approach, was that we recognized as a very small agency with minimal staffing, about 5% of the funding that actually impacts the quality of life of older people flows into our agency for the state. The rest of it goes into other agencies. And what we recognized was that we needed to identify those assets and leverage those assets in collaboration with those other agencies to focus things with a longevity lens for the improvement of our ability to be a state that's really ready for an aging population. So you're correct. We are in a time of major population disruption, falling birth rates, longer lives, and as an agency, we took the approach that our responsibility by statute to plan, to develop policy, legislation, and advocate were incredibly important roles for our agency to fulfill, and that we could do it through this multi-sector planning process. That segues into the staffing. Over the last 3 years, we've been able to really transform our agency. We've been able to, through the process available to us through DBM, reclassify positions, fine-tune MS-22s, which are job position descriptions, and work through an organizational structure that would allow us to have the capacity, the skills, the expertise to execute on multi-sector planning, on an all-government approach, and to be able to continue in a much more efficient and effective manner to distribute federal and state funds, to monitor those federal and state funds and their use, and to report on them. And so I don't know for sure, but I think I'm only waiting to sign off on one vacant position right now in our agency. I think I've got that correct. So we've basically reorganized the staff, positioned our agency so that we could do this broader, more impactful work, and at the same time be able to continue to do the work of distributing funds to the local area agencies on aging and ensure their best and highest use. I hope that answered your question.
It does, thank you. If I could just follow up then, as part of this planning process you're going through where you're looking at a long-term plan based on what's happening with the demographics and so on, does part of that plan, the solution, include putting more people out in the field, so to speak, at the local offices?
So the local offices are designated as area agencies on aging by the state unit, which is what the Department on Aging is. They actually are part of local government for the most part, and we do also have 4 not-for-profits. And we distribute funding that we receive, the state funds and the federal funds, using a funding formula that's been approved and established to direct those funds to the locals. We ourselves don't have staff to deploy to the local area agencies on aging. It's an interesting way this has all been set up under the Older Americans Act. Not a bad thing. State level, receives funding, but the actual programmatic work, for the most part, occurs at the local level in the area agencies on aging.
Let me rephrase my question another way then. As part of the long-term plan, does it include putting more money that goes to the local governments that can put into those?
I think I have to answer that by saying what we know is that the state is across all of its jurisdictions in need of resources to support older people, their families and caregivers. Whether the next 10 years will show an increase in funding that goes to the local governments, I don't think I have, the ability to really promise that or to even see that. What I do know right now, the strategy that we're using is to identify, for instance, in the Department of Labor, where is there funding that could grow the care network that we need, the professional and paraprofessional caregivers. Well, in our state, we have a very robust apprenticeship program. And what we've said is we want that apprenticeship program to focus on building the care network with people who have those skills. And also, we want the apprenticeship program to include older people. So folks that are transitioning from mid-career to late career positions, many of the federal workers that we see could really benefit from the apprenticeship program that the Labor Department is funding. So same kind of thing happening in the Department of Housing and Community Development. This great bill that's out there right now for starter and silver homes, that's funding that wouldn't come through our agency, but directly reflects the work that we do with the Department of Housing and Community Development to address housing needs among older people. So that's how we are approaching it at this point, which is looking at what are existing assets, how can they be focused and leveraged to better prepare us for longer lives.
Okay. Thank you for your patience. Thank you, Madam Chair.
Thank you, Delegate. Delegate McCaskill.
Thank you, Madam Chair. Thank you all for being here. So I'm working on a couple of different documents scattered on my desk. So just bear with me here because I'm trying to piece it back all together. So one of the main documents I'm going to reference is going to be the long-term care and dementia report, annual report from you all for October 1st. All right. Now, so I want to break this down into 2 different things. I'm looking at data. I'm a data type chick, so I need data to help me comprehend some things. I understand from your prior testimony that Prince George's County and Baltimore City have the highest rates of dementia and Alzheimer's disease-related dementia. However, according to the October report that I was just referencing, there were significantly less screenings in those jurisdictions compared to others. What is the reason for this, and what is the department doing to complete more screenings in the jurisdictions? Because as I was reading on page, it has no number. No, that's okay, but as I was reading, the data is reported voluntarily, and the definition resident contacted may vary. So I'm just trying to piece together the numbers, why they look like there's some kind of disparity there.
I'm going to ask Eloise May, our Assistant Secretary for Grants Management, to
Perfect.
respond to the specifics of that.
Thank you.
Good afternoon.
Hi.
Just to provide some clarity on how the program operates, our program manager, our state program manager, works directly with our 19 AAAs. And within those AAAs, there are program managers assigned to this particular grant. So they're working on a day-to-day basis to get out and get the screenings done just based on the referrals and the partnerships with our local partners within the community to identify individuals within each one of the jurisdictions that need to be screened and then referred to the program. So it's a process that's continuing to grow.
Okay. On the report of the outreach events, I mentioned before that I was reading that Baltimore City looks like it's pretty much tied to Prince George's County, maybe off of a percentage or so, that has the highest estimate of Alzheimer's. Baltimore City. However, Baltimore City is not on this graph at all. Is there a reason? And I'm referencing the outreach event graph, and I apologize because it's not page numbered, but it's in reference, it's from you all's report. But I'm just curious of why Baltimore City, since they have a higher prevalence as well, why they're not even mentioned on the graph.
I don't have that reference, but we can get you
follow
that
up?
information. Absolutely.
That would be perfect. We may need to follow up with this part as well. I'm looking at state trends of ethnicity. And for our Black and Brown communities, especially in the Black African American residents, have the highest prevalence of dementia in Maryland, occurring at 2 to 3 times the rate of our white residents. Is there any data that has the ethnicity broken down, either within our state, per jurisdiction, that we can reference?
I can find that out for you.
Okay.
And be happy to get that information to you.
Perfect. Madam Chair, could I just, I'm on a roll here.
You
see
are,
all
I
my
can
sticky
see.
notes. While we have you, I'll just take you. I'll take it while I can, but if you allow me. So I'm looking at, let me go back to veterans. I'm looking at the DLS report. I want to just mention something, ask something. There was something I read about our veteran care on page 4. And I just want to get some clarification around Exhibit 2 and to find out how our veterans are being taken care of, looking at the constraints we have there, and making sure that program. Can you just help explain our veteran directed care program?
Go ahead. Hi, good afternoon.
Please turn on your mic.
Jenna Crawley, Deputy Secretary.
Perfect.
And thank you for these questions.
Sure.
So we work very closely with the Department of Veterans Affairs and Military Families here in Maryland at the state level. As it relates to this specific veteran-directed care program, we transitioned that program to a provider out of Virginia who has deeper expertise as well as is a contractor for a number of these VDC programs. The issue is that it is a very complex program that requires reimbursement through Veterans Affairs at the federal level. And there were when it's not a scalable program, the resources that are required to manage that program are quite complex and extensive. And so what was ending up happening is we were not able to scale that program successfully. So we transferred that to Virginia, and the veterans are still able to receive those services in their homes here in Maryland.
Okay, perfect.
So it's more of an administrative.
Thank you, perfect. Thank you, Madam Chair. I yield.
Thank
To
you
you.
so much, Delegate. Madam Vice Chair.
Thank you so much. I'd like to stay on the long-term care and dementia care navigation program just for a second. Thank you so much. It's good to see you all. We had such a great conversation this summer at a work conference. It's wonderful to see you, Secretary. So back to the long-term care and dementia care navigation program. Last year, this committee asked the department about some reductions in general funds for the program. The department mentioned this took place as you were planning for the implementation of new grants, including training, outreach, and research partnerships with universities, you might remember. Could you update the committee on what progress has been made here to help contextualize the numbers, including the dramatic increase in fully completed screenings? Also, did the department have any internal goals on contacts and outreach? If so, did you hit them? How do you foresee continued improvement in this space, and what are some of the biggest areas for improvement, please?
Hi.
Hi, it's good to see you again.
There is continued improvement within this program. Since last year, there has been marketed outreach within each one of the jurisdictions. There's been a substantial number of outreach within the communities where there are targeted events and fairs and so forth that cater towards individuals or family members, caregivers that are caring for individuals with cognitive impairment. So there's a deliberate effort to target those individuals. So we can see from last year when the program actually started to this year that there's a significant growth within the program with continued plans for growth and outreach.
And it has been with some universities?
Do you want to speak to that?
Yeah.
Okay, so we're pretty proud of this. We just launched a family caregiver checklist, which is a partnership between 211, Johns Hopkins University, and Maryland Department on Aging. It's a free online tool that allows a person to complete the checklist and then receive a personalized care plan with referral sources that are personalized. All of this has been vetted. These are not, oh, we think this is a nice idea. We're using tools that were vetted through research by Hopkins. And so we've been able to grow that program. We've been able to identify that that is a way to grow screenings for individuals through this outreach effort. I also think that, and this is not so much related to other universities, but we are continuing to try and develop relationships, particularly with University of Maryland, around evaluating programs. And so I think we're going to see more of that as we go along into the future.
And just to add to that, there is a strong collaboration between this program and our National Family Caregiver Program, where the two managers collaborate very closely. Within that caregiver program, there's the ambassador program that are training individuals to help to really go out and seek individuals that, or family members that would qualify for the program and that would benefit from the resources provided by both programs. So there's a collaboration internally and within our AAA network so that the information and details of the program are being distributed on a broader basis. So close collaboration is one of the other key deliverables that we are working with the program to expand.
Excellent. Thank you so much, Chairwoman.
Thank you, Delegate Ruff.
Thank you, Madam Chair. And I wanted to focus on the audit findings. There was an audit performed where the results were released last April, a time frame of July of 2020 to March of 2024, where 3 findings were the result of that audit, 2 of them having been recurring findings. And so I wanted to go through them one by one, starting with number 1, that your agency did not perform all required program reviews of the local area agencies on aging financial activity and related programs or adequately document the reviews performed. Can you give us an update since last April? I believe you all concurred with all the findings. Where are we with finding number 1 about the performing the required program reviews and adequately documenting the reviews performed?
Delegate, I'm going to ask Michael Zomber to speak to the specifics, but I do want to make this statement. When I came into the agency 3 years ago, the positions that were required to actually do that kind of work were not filled or were not adequately filled. And it was a concern that I had immediately with regards to our fiscal responsibility. And so we have been very focused on making sure that we have the resources we need to do the work that must be done in order to address these kinds of findings. And I'll let Michael tell you what we've done and where we are.
And just so you know, I did read about the auditor position that you guys are doing internally on a rolling basis. So you can, talk on top of that, how that's working out and how it's producing the results that we want to see on the turnaround there.
Okay.
Thank you very much for the question, because the audits are certainly a very important component of our fiduciary responsibility. We've taken a number of steps in this regard. We played catch-up in June of 2024. We hired a consultant, an outside contractor, to do audits for FY21 through FY23. From 6 months between June and December, they completed audits for those 3 fiscal years. Then the plan was to hire an auditor, a full-time auditor, which took a few months, but recently, in the fall, we did hire an auditor, and he will be completing. He's done just about half of FY24 audits, and by the time this fiscal year has ended, he will have completed all AAAs will have completed audits for FY24, and we will be completing them on a rolling basis year after year, and with the addition of fiscal oversight at the top levels that was not there at the level we wanted previously, and we commit to ensure that those audits continue and with the proper fiscal oversight.
So are you saying that specifically as to this first finding, that's the update on where we are?
Yes.
Okay. What about the second finding? Or is that going to be the answer for all 3 findings? So the second finding is that your agency requests for reimbursement of federal fund expenditures, and I just note that these first 2 findings are recurring findings, that this is not the first time that an audit has been performed and found this to be the result. Requests for reimbursement of federal fund expenditures were routinely submitted late or not submitted at all, and that as a result, MDOA is no longer able to recover $200,000 in funds and lost investment income totaling at least $63,000.
Yes, thanks for the question. So under new fiscal leadership, one of the first steps we took was to improve the cadence of draws, that they're done monthly. And each and every month, we're drawing down federal funds primarily for the OA programs that are the bulk of our federal funding. In addition, we did recover nearly $1.5 million in federal funds that were undrawn previously. There were administration funds that were not drawn in previous years, that based upon an analysis that we did together with OLA, we had determined that we were still able to draw these funds, and we worked with ACL, and we were able to recover the vast majority of those funds. We do believe that the current routine that we have in terms of doing the monthly draws and the oversight that we're engaging in will avoid these findings in the future, that we do not believe that this finding will be a recurring finding.
Okay. And then for the third finding, can you just tell us, can you give us an understanding briefly of what the naturally occurring retirement community is?
Yes, I can speak to that.
That'd be great.
Thank you for that question. So the naturally occurring retirement communities is actually, we call it NORC for short, and we've had that funding stream for about 20 years or so in our budget. And what DLS OLA found in the audit was that the award of those dollars lacked sufficient transparency in the selection of the grantees, and also lack of documentation about grantee qualifications. So we took that very seriously, and also did not want repeat findings for our next audit, and implemented significant process changes as a result of that. Given the timeline of when we received OLA audit findings, which was in about April, we instituted a competitive grant process that clearly delineated qualifications, budget, priority for continuity of operations of existing grantees, and implemented that process to award the grants as of July 1, 2025. And so we have a pretty comprehensive process, and recognize that this was a significant transition in the first year, and so we wanted to preserve those continuity of operations, and did that through the scoring process.
Yeah, I have a follow-up on that as well, but if you want to take it first, and then you probably are thinking what I'm thinking, but go ahead.
No, I don't actually have a follow-up on that specific question.
May I interject with? Okay, let me,
So you go ahead.
thank you. I'm going to just interject really quick here. NORC is one of the grant programs that supports Holocaust survivors, correct?
Correct.
And I know we've been hearing from advocates related to this work about how some of these dollars receive matching funds from like an international Holocaust
Yes.
fund as well, and it helps keep these programs in operation, basically in our state, to support this particularly vulnerable community. So just so that I heard it correctly, the competitive grant process at this state for this fiscal year, and you've been in communication with these grantees as well, are they going to continue to receive these dollars for this fiscal year?
The fiscal year that we're in, or the fiscal year that we're looking toward?
How about both? How about both?
So they
Yeah.
have been awarded the dollars as per the competitive grant process. All of the previous grantees received those same amount of funds, I believe. And there's a max within, it's about, if I remember correctly, 1.3 million or so, and it was historically given to 6 grantees. And so all of those previous grantees were also awarded the funds. And as it relates to this upcoming year, we are committed to continuing the competitive process that delineates the priority factors for organizations serving Holocaust survivors, elder safe activities, and then also, I believe it's aging in place.
Okay, got it. And just so that I understand this, I appreciate you allowing me to delve into this. Aside from the grantees that are currently doing this work, are there other potential folks out there that could potentially serve this particularly vulnerable community?
So there, I'm not sure if you're alluding to one of the sub-grantees that was not selected as part of the competitive process.
I'm not alluding to anyone in particular.
Because we have had a lot of discussion with the representatives of these organizations. And so there is one additional organization that historically was a sub-grantee of one of MDOA's grantees. So a little bit of a technical challenge that was raised as part of the grant award or the grant application process. And in theory, our objective review process actually resulted in more transparency around how these grants were awarded as it related to a points-based system. So in other words, one of the grantees did not score as high, or one of the applicants, excuse me, did not score as high as some of the other grantees. And I can go into greater detail.
Okay, got it. Yeah, I think I'd like to follow up offline on this particular program, just if I may, but because as I'm reading the audit, and I certainly think it's absolutely necessary that the department comply with the audit findings, as we take these very, very seriously in our committee. But I want to make sure that my read of the audit, that I'm on the same page as what the problems that were identified here and some of the solutions that you guys have put forward. So thank you. I'll yield back to Delegate Ruff for his questions. Thank you.
Thank you, Madam Chair. Just one additional area I wanted to follow up on, and it pertains to the State Long-Term Care Ombudsman Program. And so that is the program that advocates for residents of nursing homes and assisted care facilities. Is that correct?
Yes.
Okay. Can you give us a sense of, kind of the daily operations of that office and kind of a really brief summary?
Excellent question, thank you. And it gives me a chance to sort of explain something that's not very clear to most people. The Ombudsman program is housed in the Department on Aging. However, it is totally independent of the agency, and that's by statute and by funding source. It's the federal program requires that the Ombudsman program be completely independent in its functioning. It's in other states, it's located in other agencies. In Maryland, it is located in the Department on Aging. So I just want to make that piece clear. It functions very independently. I'm very familiar with the Ombudsman program, though, from my long years in the field, and the great work I experienced with the Ombudsman program in Maryland over the years. That program oversees staff and volunteers who are trained very specifically and very intentionally around being able to come in to an assisted living, an unlicensed assisted living, and a nursing home and meet with a resident. It is completely driven by the individual resident. So the work is confidential. It is not what perhaps the institution where that individual calls home. It's not what they want. It's not what their family wants. It's not what the doctor wants. It's what that individual wants. It's a very powerful tool to ensure that the voice of the older individual has equal weight in decisions that are made about them. Very good.
Now, the SOAR program, or the programs that now, comprise the SOAR program, do they feed into the Ombudsman program with complaints, or how does that work? Where, for instance, in my district, we have elder care facilities, folks that are having significant problems with management of those facilities, failures to respond to their complaints, failures to fix facilities, fix elevators. I actually have a bill right now about transparency on elevator inspection and the working order of elevators in all over the state, but targeted towards elder care facilities. Does the SOAR program address that, and how is the implementation of the SOAR program going as we sit here today?
So I'm going to ask Deputy Secretary Crawley to respond specifically to the SOAR program piece of it. But I will say that one of the things that the Department on Aging is very engaged in is a work group that's working with the Maryland Department of Health. We're co-leading a work group to look very broadly at this issue of licensed and unlicensed facilities, and the situation and circumstances that may be impacting the quality of life of older people. And one of the, it's a knotty, complicated issue, has to do with enforcement, the law, rights, all of those things, as well as just straight up with there being enough capacity in the state to safely and reliably accommodate older people, places for them to live and receive services. And that's why we see people living in, all kinds of circumstances that are causing some of the concerns that we have about vulnerable older people.
Right. Well, and I don't mean to cut you off, but I do really want to get at what aspect of your agency actually addresses advocacy outside of the independent arm of the Ombudsman's office, and then how does that interplay with the implementation of SOAR, and generally how it's
All right.
how it's coming along the implementation of the program.
Let's talk about SOAR, but we are mandated reporters, so any of our staff at the state level that is aware of an individual being neglected, abused, or experience fraud of some kind, we're required to report that to the Office of Healthcare Quality or the Adult Protective Service Agency and Human Services. We ourselves don't do that level of work, so we do referrals if we're aware of it. And the same is true at the local level, among the area agencies on aging. So if you want to talk about the SOAR part, go ahead.
Thank you. Thank you for the question. So as you're aware, we had legislation that was passed last year to consolidate our 3 programs of SALS, senior care, and congregate housing, which for a total is $20.1 million that is then distributed to the local area agencies on aging. We are in the transition year and not yet into implementation. FY27 is when we are to implement SOAR. We have worked very closely with our partners at the area agencies on aging as it relates to what SOAR is going to look like, which is also known as supports for older adults. No, I'm going to mess it up. Supporting older adults with resources. Thank you. We have so many acronyms. So supporting older adults with resources. And so what we did as it relates to this first half of FY26 is we convened an external work group that was based on the legislation and to identify recommendations for what implementation and transition should look like under this program. We received those recommendations mid to late September. Then we convened an internal work group to review those, recognizing that this is complex, very complex work. And based on the recommendations that we reviewed from the external work group, we issued a procurement request for an HCBS expert to inform what this implementation should look like. And we issued that in late November. They had a very condensed period of time to take basically all of the work that we have done, both with our external stakeholders, with the Longevity Ready Maryland work, with our expertise from a technical assistance, advancing states, and synthesize that information to advise us on what implementation should look like and should include. We received that report last night after hours and are eager to dive into it to understand the recommendations that are a part of that expert report. With that being said, We have an in-person meeting with our AAA directors in March, and we plan to review those recommendations and also partner with our AAAs, because essentially they are the service delivery providers on the ground and within our local communities. And so we expect them to help to inform what this transition process looks like and ongoing implementation.
Thank you. I asked that question specifically because literally an hour before walking into this meeting, I had about 7 different complaints from older adults from the Bell Park elder living facility in my district with various complaints in writing within the past 20 days. I would love for you all to see those and to use those in that conversation you have in March. Because what I've read was very concerning, and I think that you all have the tools to help us address it. So I look forward to talking offline about it.
Yeah, absolutely. We're happy to do so.
Thank you so much, Delegate Stanko.
Just as a follow-up to what you just shared with your March timeline, have you provided, and I guess you just said you get some information last night, have you provided written guidance to the AAAs yet, the local agencies yet?
So in December, we provided written guidance as to what they could expect around the funding formula, and provided that in late December. And then from that perspective, otherwise, no, we have not, because we're still in the process of understanding what the recommendations are and reviewing internally.
As just a follow-up to that, when do you think, you mentioned March, but when do you think you'll have your hands grasped around it completely from your side to be able to distribute written guidance to them?
So this is an ongoing process. We concur with the DLS recommendation of a written report by June 1st.
Okay, I think one of the things that we've been hearing is anytime there's something that change management happens, you get anxiety from folks involved. We had stuff locally that was unrelated, but you understand change management, and it's one of those clarity's kindness. So I think that's just something to keep in mind. As soon as you can provide that, I think the better. Obviously, I know worse than that is walking stuff back, but just keeping those pieces in mind, because we're hearing that and want to make sure you're aware. And then just referencing as a follow-up, if that's okay, referencing the transition from the prior 3 programs. There were some individuals that were on those wait lists, correct?
Yes.
Can you give us an update on what has happened with those folks or will happen with those folks as the transition to SOAR occurs?
In terms of specifically the wait lists?
Yeah.
Okay, so the AAAs manage the wait lists at the local level, and that will be part of the transition, recognizing that this is a multi-year process. I recognize there's been questions about legacy participants, so essentially people who are receiving those services now. What we do plan to do is work with the AAAs as to what that looks like in terms of continuing to serve those individuals. We do not want anyone to lose services, and so there needs to be a comprehensive transition plan. Right now, our AAAs are currently conducting person-centered plans to identify what eligibility exists, if there are other programs that could serve them better than SOAR, as well as if it makes sense for them to continue on SOAR, or from senior care, SALS, and congregate housing to SOAR. In terms of the wait list, that will be up to the AAAs in terms of how they choose to manage the people who are currently on the wait list. But we would expect that they would apply the same person-centered planning process to those individuals to identify which resources are best.
May I add something? Just building a little bit on what Deputy Secretary said, part of what we are sharing with you is the actual process of system change that we are in fact engaged in as we try to prepare for longer lives, more people needing services. And recognizing that the programs that were put in place 40 years ago just aren't really able to meet the current demand. And we are, as part of this exercise, doing a lot of work with the Department of Health Long-Term Services and Supports Division, because we're trying to identify, are there other resources? Are there people who are eligible for home and community-based services paid for through the Medicaid waiver? Are some of these people eligible for programs and services that are perhaps coming through the Department of Human Services? It goes back to that sort of all of government, let's identify the current assets and figure out how to coordinate and collaborate so people can get service and not have it so constrained by where do they live. That's one of the major problems. It's why we combined the program and made it one single SOAR. Where do they live, or what their fiscal eligibility is, or their immediate current status in terms of their health and well-being. So part of the longer-term work is going to be to understand that we have people who are being served or not being served. They're on waiting lists. Is there some way they can be served, either through the SOAR program or through other existing resources? And what's the gap? What's the actual scope there that needs to be addressed?
I appreciate that. I think my, challenge or thing to keep in mind as you think about statute or policies, like policy timelines that have been left out, I always say whatever we're thinking about every day is like top of mind for us, and any of us have our benefit of thinking everyone else has the same level of like internal marketing to the things we're doing. And especially as you think about that getting to the end user, which is the elder care person or participant that's looking for service, that breakdown in communication can turn into like a blame factor, right? Of well, we don't know yet because they haven't told us, and delay and pushback. And so, and I think when we hear about advocates just asking questions already, that process already starts. So just, I guess my recommendation, challenge, but however you want to see it the right way, would be over communication is also always better. And especially with the people that are at the end of the day touching your end users, my piece of advice, if you will. So thank you, Madam Chair.
Thank you, Delegate McCaskill.
So very much, Madam Chair. I just want a last bite of the apple, but my two colleagues mentioned something that did come to my office today, and navigating and helping our elderly population, our aging population, navigate. More information is better. I think two of the calls today that came to my office with complaints specifically to Augsburg is just literally a breakdown of communication of how our aging population is to navigate. And so we had, not necessarily thinking they may need a flow chart, but maybe they do need a flow chart or picture chart or some kind of other resource to help them navigate when they have a complaint. And also because they feel, expressed to my office today, that they don't have great advocacy within their institution. But I want to circle back. I want to go right back to, and this can be a follow-up question. When I was thinking about the stats in Baltimore City and those questions around the outreach events and those folks that you touched, I want to go back to and I was looking at the stats again, and I'm looking at that the highest prevalence for dementia in Maryland goes to the Black community. Just out of curiosity, how are you reaching out to that specifically, our specific community? What's the outreach around our community?
So again, the Maryland Department of Aging, as we work with our local AAAs, they are the ones that actually are the boots on the ground and do the outreach. But if there's a specific target population, they would navigate those, those outreach efforts. So that if there's something that we need to do within specific populations, they can coordinate that and, provide that, that particular outreach. So if there's a specific AAA or jurisdiction and we would communicate that with them.
Yeah, so, and I don't know, again, why Baltimore City seemed to be missing in any of this data. I'm curious because we have had some concerns around Baltimore City and Prince George's County residents not having, feeling they don't have the proper resources. Maybe they're there and it's not there, they're not able to reach and specifically the Black community, since it is the highest prevalence, 2 to 3 times the rate. Are there any specific targets or program for that community?
We'll follow up and get back to you.
Thank you. Thank you.
Of course. For all the items of follow-up, I think we probably have several members of our committee that are really interested in this. So I think typically it comes through our analysts and then is distributed to our full subcommittee, correct? So we thank you for serving in that capacity again. I just want to take a moment to kind of ask a couple of final questions of this wonderful panel. First, a quick comment, Madam Secretary, congratulations on 50 years, right, in this field?
Well, yeah, you know, it's like, I'm not 90. I just got started young. So I am 70, which I'm very proud of, and I told my staff eventually I'll stop announcing that to everybody. But this year I'm very proud of it, so I have to tell everybody.
50 years in the field, right?
I did. I started when I was in college. My very
Amazing.
first job, I was an activity aide at a senior center.
That's awesome.
And it's been my life's work and my passion. And I am so grateful to now be able to be in government and continue my service.
Well, we are grateful to you. I wanted to take a moment, please, to just follow up on Delegate Ruff's questioning related to the long-term care ombudsman program. As you know, this is a program near and dear to my heart, and while they are independent, they are also under your agency, and so I wanted to ask, just a follow-up, how are they different in function than OHCQ? Can you share?
So the Ombudsman program, first in that it is not focused on institutional compliance. So OHCQ is responsible for the licensing and enforcement of standards at the institutional level.
Mm-hmm.
So the Ombudsman is very person-centered. It's the individual resident.
They're sort of like the consumer representative.
Yes.
Kind of like how the MIA represents the insurance, right?
Probably a good way to
we
think
have an
about
issue with our health insurance, we can go to them and complain, and then
Right.
they serve in that capacity
Right.
to kind of figure out what's happening.
The other thing that is very different is that the Ombudsman has no enforcement power. So in the way, OHCQ operates, they can close a facility down. They can move people out of a facility. They can, there can be civil money penalties. There, all kinds of requirements that folks come into compliance. That isn't anything the Ombudsman can do.
So if they make a finding of a really egregious situation on behalf of like a person who lives in a nursing home or an assisted living, like with memory care, for example, what happens in those instances?
So with the resident or their responsible agent, if the person can't speak for themselves, with their permission, they can report to OHCQ. They can engage the Attorney General's office. They can do all kinds of things with the permission of the individual or their responsible
Right.
agent.
So they are representing the interests of that individual
Yes.
in those.
Yeah.
And arguably, can an argument be made that they are, a little bit, their work can contribute towards higher quality care in these facilities?
Oh, absolutely. And in
Okay.
fact, that's a big piece of what our ombudsman has been working on,
Right.
with training toward person-centered care, and also just generally trying to help people understand what it is an ombudsman does, but also what the life of a resident can
Right.
be like.
Right.
And
great.
responsibility to improve that. and Things
Amazing.
that could happen.
Thank you. And just a last question. Do Did this budget analysis, or did your budget say about how much they receive in funding, or in FY '27?
I think it may, I don't,
Total?
yeah.
82 million.
Sorry?
82 million.
No.
No, for the long-term care
Just the
ombudsman?
ombudsman. It's,
The ombudsman is in the room.
The ombudsman's here.
Hello, how are you? Good to see you, Madam
Carrie,
Ombudsman.
Come
Yeah,
on,
come
sit.
on down.
Come on down.
Price is right. We heard numbers yelled out and then come on down. Madam Ombudsman, nice to see you. Welcome. You are new to this hearing room, I believe, so thank you. We all are. I think you might need to pull a chair up so that we can see you on camera, otherwise it'll be just your belly on the camera. So your office for FY '27 receives about how much under this?
We receive about 1.1 million from the state and about 400,000 from the federal government. So
You're like a little over 2 million total for the entire operation of your office.
1.5.
1.5.
1.5.
And then can you share a little bit about, because I know you come from another state, if I recall, can you share a little bit about how it compares in other states to your knowledge?
Sure. I just actually received some information from Washington, D.C. They actually receive 1.1 million in D.C. alone, which is very small, very small. I came from Michigan, and their budget is just over 5 million.
Okay, and how many residents do we have in Maryland currently under, who could potentially be represented by your office?
Sure. There's about 54,000 long-term care beds in Maryland, licensed long-term care beds. But that doesn't count people. So people move in and move out. So we are having an impact on more individuals than that.
Okay, got it. And last question, how many complaints did your office receive and what was the disposition of the cases?
Sure. We received about we resolved about 4,000 complaints in fiscal year 25. And so according to ACL, our dispositions are, we resolve complaints to the satisfaction of the resident. And our satisfaction rate is about 80%.
Wow, that's amazing for a government program. Thank you very much.
Yes. Can I explain just one thing when it comes to the difference between the Ombudsman program and OHCQ?
Yes.
This is really, really important to me, and why our program is so amazing is because, just like the secretary said, she did a great job, by the way. Yes. We resolve complaints to the satisfaction of the resident. So a resident has a complaint. We can get in there to see the resident with our program. Policy and procedures state that if it's harm or abuse that's happening to a resident, we have to see that resident within 1 working day. And if any other complaint, it's 7 working days. So we get out to see that resident really quick. And then we advocate for what the resident wants. Now, if OHCQ is called, they may not get out for an entire year, depending on the severity of the complaint. And then they find whether the home is in compliance or out of compliance according to the federal regulations and state statutes. If that home is out of compliance, then the home has to have a plan of correction, thank you. And that plan of correction usually does not include the resident. So all of that's done and the resident is still upset. So the ombudsman can come in and we can resolve that complaint according to what the resident wants, work with the home, be a resource to the home, and then everyone wins, which I think is amazing.
Incredible. Thank you so much. I really appreciate the work of this panel, and thank you for being here today. I like conjured you somehow. I love that. Okay. Well, thank you to this great agency for your work. We look forward to our continued conversation. I do want to ask, just a reminder again, we do have 5 witnesses who are here to testify today because, actually, now that our ombudsman has brought an extra seat up here, we might be able to take everybody in one panel. Please stick around, agency, so you can hear the feedback. And as we have further questions, we can then reply to you subsequently. So thank you so much. I'm going to call down the 5 witnesses who have signed up to testify orally. We have, and forgive me, please, for likely pronouncing names incorrectly. We have Ann Geddes with the Mental Health Association of Maryland, Ann Seacott, Maryland Association of Area Agencies on Aging. We have Sarah Westrick with AARP Maryland, Megan Peters, Alzheimer's Association, and Carol Leinhard, Maryland Senior Citizens Action Network. You all have 2 minutes each for testimony. So usually I ask my good friend, our committee counsel, to do the honors of doing this, but I already got my clock up, so let's see, I see 4 and a 5th coming up. Okay, perfect. So we'll just start right on this end here, and just identify yourself for the record as you begin your testimony. Thank you.
Thank you. Good afternoon, Chair Shetty and members of the Health and Human Services Subcommittee. My name is Sarah Westrick, and I'm the Advocacy Director for AARP Maryland. AARP Maryland is one of the largest membership-based organizations in the state, with approximately 850,000 members. Thank you for the opportunity to speak in support of the Maryland Department of Aging's budget for the upcoming fiscal year. As advocates for the well-being of Maryland's older adults, we want to emphasize the critical role that MDOA plays in improving the lives of our aging population and ensuring they receive the resources and care they need to thrive. Maryland's senior population is rapidly growing. By 2030, it's projected that 1 in 4 Maryland residents will be 60 or older. The programs and services funded through MDOA are essential to addressing the challenges that accompany this demographic shift, such as food insecurity, housing stability, access to health care, and social isolation. The FY27 budget protects core services for older adults and reflects responsible realignment of federal programs, such as transitioning the veteran-directed care to the Department of the Veteran Affairs. The creation of the Supporting Older Adults with Resources, or SOAR program, modernizes Maryland's aging services by consolidating program structures, reducing administrative demands, and increasing flexibility for the area agencies on aging, or AAAs. The budget also strategically invests in caregiver support and dementia services. I want to say a word about the Longevity Ready Maryland plan. We welcomed heartily the launch of the initiative in January 2024 and served as a key stakeholder in the plan's development. It's a comprehensive 10-year multi-sector plan that aligns state, local, nonprofit, and private partners to strengthen aging services in Maryland. The plan also aligns with AARP's mission to empower people to live their best life as they age.
Thank you. Do you want to finish your thought?
Just that we express our full support of the budget and the work of the MDOA. Thank you for your time today.
Thank you so much for your testimony.
Yeah,
Next
hi.
witness.
Thank you. My name's Ann Geddes. I'm the Director of Child and Older Adult Policy at Mental Health Association of Maryland. In that role, I chair the Mental Health and Aging Coalition. Just want to say we're somewhat disappointed that there's no increase in the Department of Aging's budget this year, and instead there's a small decrease, but we certainly understand the state's current budget concerns. Regarding the next fiscal year, our greatest concern is the implementation of the new SOAR program. As has been mentioned, the last year the department consolidated 3 programs into SOAR, which to create efficiencies and potentially serve more older Marylanders than currently. We supported and testified for that bill. The department now must move quickly to provide clarity and guidance to the local areas on aging, so that they can plan, develop budgets, and ensure that the recipients of current funding streams receive appropriate continuity of care. AAA funding levels must be maintained. Looking to the future, as has already been mentioned, Marylanders are getting older. As the number of older adults in Maryland continues to rise, there will be a need for increased funding for the department and for the AAAs. Thank you.
Thank you so much. Lots of time to spare. Hi, Ms. Peters. Good to see you. You may begin when you're ready.
Awesome. Thank you. Good to see you all. Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is...
You want mine?
Turn off? Okay. My name is Megan Peters. I'm Director of Government Affairs for the Alzheimer's Association here in Maryland. We are grateful for the $2.4 million for the Dementia Navigation Program that has been maintained in the proposed fiscal year 2027 budget. And thank you for preserving that funding in last session and just for the robust discussion earlier with the department for your interest in its growth and support in the years ahead. Dementia navigation is a critical support for our families trying to understand what to do before and after a dementia diagnosis. We know many Marylanders are impacted by dementia, and families often tell us how they need help figuring out care options, local resources, and how to plan ahead. The navigation program is helping them with recent resources coming online, like the validated AD8 screening tool and the family caregiver checklist in partnership with Johns Hopkins, which we're really excited about. Ensuring steady funding and possibly growing that funding in future years as the budget allows means people can get timely guidance instead of waiting until a crisis. It also means caregivers don't have to tackle a very complicated system alone. I also want to note that we appreciate the department's broader efforts to modernize the services for our older adults. As SOAR rolls out, we note that the continuity of care is going to be critical, especially for families living with dementia. Even brief disruptions can have real impacts, and we support the proposed Joint Chairman's Report language to keep everyone updated on the planning and implementation of SOAR. We look forward to continuing our partnership with the department and the AAAs, and thank you for the support in this vital work.
Thank you, Ms. Peters. Next witness.
Okay, good afternoon. My name is Carol Leinhard, and I am the retired director of the Harford County Office on Aging, a past president of the Maryland Association of Area Agencies on Aging, and the current co-chair of the Maryland Senior Citizens Action Network. And I'd like to challenge you as to who's the oldest here. I'm 82 and I'm still here, still coming. I've got 55 years in the aging field, and so I'm here on the basis of my heart, working with you. And as always, when I come down, I commend the Maryland Department of Aging on their work with the Maryland Area Agencies on Aging, because they are indeed the front line for the delivery of services to older folks in Maryland. And as legislators, I know you always hear gripes about how much it costs to provide services. Well, here we have examples that the Maryland Department of Aging's programs actually save money. I'd like to use just one little example. The senior care program takes about $4,500 to provide services to a vulnerable senior in Maryland for the course of 1 year. And if you look at the waiting list, and many of you are familiar with the waiting list, 1,999 people on a waiting list, and historically, in my years of service, about 150 folks go to nursing homes from the senior care waiting list before they're able to access those services. Institutionalization of just those 150 people costs the state more than $20 million. And you've all heard this afternoon that the whole SOAR program just costs $20 million. So I appreciate the fact that you support the programs of the Department of Aging, and we're happy that we can work with the Secretary on the new Longevity Ready Maryland initiative, and has been spoken by the group here. We're concerned and are counting on the cooperation and the working with the department on the provision of legacy services to those folks who have been senior care clients. And based on the fact that you've had that discussion, I think that you're going to be watching with us to make sure that those folks continue to be served, and we appreciate the opportunity to testify this afternoon. And thank you so much for your time. I have just been heartened by the interest that each of you have presented today in all of the aspects of the programs for the Department of Aging. But I also know that from those calls that you get, that list of calls of complaints from your folks, you know where to go to get information and to get help, and we're happy to provide that. Thank you so much for the opportunity.
Thank you for your continued advocacy and for your 55 years of service.
And for my old age, right?
And, well, sure. I would never have guessed, honestly. Like, we were just talking about how we'll have whatever you're having. Yeah. Yeah. Thank you so much.
You're welcome.
Ms. Seacott, for your
Thank you.
testimony.
Before you hit the timer on me, I just want to take a moment to recognize other people that are here. So I'm representing the Maryland Association for the AAAs, the Area Agencies on Aging. And we have with us here today the representatives from the Anne Arundel County AAA, the Montgomery County AAA, and the Howard County AAA. So I just want to make sure they are recognized. We are here to testify in support of the governor's proposed 27 budget for the Department of Aging. As you all know, the AAAs play a central role in supporting older adults and caregivers, and we value our ongoing partnership with the department as we adapt to a growing and increasingly complex set of community needs. On supporting older adults with resources, SOAR, we want to say that we remain committed to continuing our partnership with the department. We think that streamlining services and providing more flexibility is a great goal, and we want to help make all of that happen. We were very encouraged to hear that the funding for the AAAs should be consistent, at least for the coming year. So we're under the new program, so we're happy about that. Very excited to learn that just now that there's the report from the consultant is now available. We hope we don't have to wait till March to hear some of the details, but that's wonderful. I want to make sure you all know that AAAs right now screen all of the clients that they serve, and they make sure that they are providing as many of the services or connecting people to as many of the services as possible. They really are the provider of last resort. And remember also, they're not always serving people who are Medicaid eligible. There are a lot of folks that they serve who just aren't or never will be eligible for Medicaid, yet they're still there taking the rightful advantage of state grant services. So we continue to work with the department on SOAR. We continue to support the department's work on Longevity Ready Maryland. We absolutely are in support of the long-term care dementia navigation program. We're very pleased to see that fully funded. Keep that one going. And my last word is actually similar to something that's been said a few times here, including from Delegate Heinbaugh, about the future of funding. And we're all getting older, and we're not going to be able to keep up with the growing number of people in need, the growing complexities of need, without additional funding to these services. It's wonderful to do the cross-department collaboration that's happening. I just believe that the growth of the population is going to outpace any efficiencies we can find in total. We want to find those efficiencies anyway, but we're going to need more money in the coming years. So,
as will all of us.
Whisper to the governor for next year.
Thank you all so much for your helpful testimony. Do we have any questions for our panelists? Seeing none, we really appreciate your advocacy and continued engagement on this important budget.
And thank you all for everything you do.
Oh, thank you. That's very kind. So that concludes our third and final budget for today. Tomorrow we have the MDH overview. We have a lot of reading to do in advance, so thank you so much. Our meeting is adjourned.